Hi guys. Today is Wednesday and we just finished consultations early, so it's almost 7 o'clock. And I wanted to begin with the Wednesday lesson of the day this week, which is how fillers affect the face in the long term. I had a couple patients come in today, including a patient I'm operating on tomorrow with overfilling in the mid-face. And the questions that were brought up by the other patients is, should I dissolve my filler? Why and why not? And I'm getting a facelift, so why or why not dissolve the filler? And I told these patients, give them all different answers. So running through my first patient, she had overfilled cheeks, but very slight. Very, very slight. Not to the point where it bothered me or bothered anyone. She asked, should I dissolve it? I said no. Why don't you want to dissolve somebody who's had filler in the mid-face for 10 years? The answer to that is because the filler sits in there and causes what we call like a microcystic expansion, meaning there are tiny little gel beads that sit within the SMAS layer, subdermis, and fat layer, and they do cause a little bit of increased laxity over time. So if someone asks you, will fillers age me over time? The answer is they can, and it happens if you expand beyond your natural volume. So if you expand beyond your natural volume from whatever you had from teenage years until adulthood, you can actually get more laxity in the skin over time, and when that filler metabolizes, you have aged a little bit more rapidly. That's called the filler expansion effect. You do need a lot of filler to do that. This lady that asked me that didn't have enough, and it felt as though if we would have dissolved her, it would have caused more problems than good. So dissolver is a great thing to do when needed, but if you don't need to do it, don't do it, because yes, you can deflate certain areas in the mid-face, and why do that? It's going to cause problems in some people. The other patient Bobby Normand, the best. So the other person who asked me was our facelift patient for tomorrow, and she had overfilled cheeks with hyaluronic acid going all the way out. And her question to me was, she had said she had threads before, and she wondered why her smile had changed over the years, thought maybe it was the threads that had caused it. I explained to her that no, most likely the reason you have the problem smiling is because your zygomaticus muscle, which extends from here down to over here, is infiltrated and surrounded by filler. And in that case, you should get rid of it, because you're never going to get a smile back as long as you have all that filler around that. And she does also have filler expansion, meaning once I dissolve her, it could be a shit show. It could totally collapse, and she could have super lax skin and indentations and different quality to the skin that she would not have had if she hadn't had the fillers. So can fillers cause a permanent effect in the skin? 100% they can. Can dissolver cause a permanent effect in the skin? 100% it can. So to people who have limited kind of brain capacity, that means never do filler, never do dissolver. To anybody else, it means no, you tastefully do filler, you can tastefully or carefully do dissolver. And in this case, I chose to dissolve her because we're doing a facelift tomorrow, and her cheek is so expanded there that I wouldn't be able to get a good mid-face lift without getting rid of it, because filler, although it doesn't lift, you can get an appearance of lift in the under eye. If you expand someone big enough, it does tighten out the skin. And I wouldn't say that's a good thing to do, although that is the consequence. So if you do overfill somebody, yes, you can lift and you can tighten up the skin, but that is not a good idea. So in this case, she was a little overfilled, and she had a very delicate, beautiful face. Otherwise, she's very pretty, and this didn't really sit well with her. So I put a bunch of dissolver in. I do dissolve pretty dilute amounts in a large, I'd say a large amount of like lidocaine, because you don't need that much to dissolve a lot in the cheeks. So for her, I put 80 units of Vitreous total, so 50 units on the left side, which was the big bulky side, and 30 units on the right side, which was the less bulky side, which was her favorite side actually. So the side that I dissolved is going to take probably 3-4 days to settle. We're doing the surgery tomorrow, but that's fine. I just needed a little more relaxation so I can lift her with no problem. And if I had waited 4 days, it would have been better, but we don't have that much time. The other thing that you see is after 4 days, the patients start to rehydrate. So they get a big major collapse in the first 4 days. First day is the most, and then they start to rehydrate over the course of the next 2 weeks. Patients who don't have filler expansion, if you put dissolver in them, they tend to recover pretty well. Patients who have filler expansion problems, which means they have that microcystic expansion within the tissue layers, especially in the SMAS, collapse pretty substantially. So those are the patients, if you're wondering who gets the problems from dissolver, it's the people who were damaged from filler. So that's a question a lot of injectors have, is how do we know who's going to have the problem with dissolver? My answer to them is the older a person is, the more sensitive they are to dissolver, and the more filler damage they have, the more you're going to see an exaggerated response. So it's not that the dissolver damaged them, it's that the filler damaged them, and you got rid of the filler that was holding out this damaged tissue, and then it collapses. To make it worse, yes, you dehydrate once you do dissolver, and it takes a couple weeks for it to come back. I had another patient, same issue. She had filler in the face that she said was making her feel heavy, and I looked at her and I couldn't see it, and I can see things pretty well. So I advised her, don't dissolve it, because if I can't see it, I don't know what I'm going after, and then all I can really do is damage you at that point. It would be very unlikely for me to go put dissolver into like the filler only and not hit your SMAS or anything like that. So answer to all this stuff is, it's kind of an art. It takes a long time to get good at it. Fillers are great when done tastefully and in small amounts. Dissolver is great when done carefully and in the right places, and not just haphazardly done and injected all over the place. So all this stuff can cause problems, just like surgery. It's like surgery can cause a problem. Doing a facelift like an idiot is going to cause a problem too. So you can't say facelifts never cause problems. They have risk. You can't say filler never has problem. It has risk. You can't say filler will never age somebody. There are many situations where it can age somebody. And you can never say that a dissolver won't damage someone either, because it's possible for it to do, especially in the patients who have had filler expansion. So filler expansion is a big problem. If you come to my office with filler expansion, most of the time I won't want to touch you, and it's not because I don't like you as a person. It's because once you're damaged and expanded by filler to a substantial extent, nobody can fix you. You're going to get dissolved. There's going to be indentations and collapse and dehydrated appearing skin, and then you have to refill, and then you have to dissolve, and then you have to refill. It becomes this cycle of terrible stuff. So fortunately for the lady we're doing tomorrow, she only had put stuff in concentrated areas, and it was an easy thing to dissolve where I don't really lose too much predictability. And I did make her aware, know that once I do your facelift, because I dissolved you, in the future you might have to put filler back. And I know we're doing a facelift to lift the face, but there are going to be some areas where filler remains, and then you have filler indentations in other areas, or collapsed portions around the dissolved area that might need to be refilled later. That is the unfortunate part of filling and dissolving, but you just better realize that before you go dissolve an overfilled face. It could be a never-ending cycle, or it could be a few more times that you have to go fix it. So that's all. Hope that answers a lot of questions. I'll go over a couple questions really quickly before my patient gets here. Can you dissolve filler when placed on bone? Yes, absolutely. Filler goes away pretty easily as long as it's a hyaluronic acid filler. So just remember that there are other types of fillers that people do. The most annoying type of filler when you do facelifting is going to be silicone, Bellafill, Artefill, and then Radiesse. Nobody likes Radiesse in the mid-face soft tissues. It forms calcified little granules everywhere, and it's not fun to deal with. In the last video, you did a Russian girl model. You did Botox under her eyes and eyebrows. What does that do? That just lifts the eyebrows slightly. That's all it does. Yeah, okay. Well, so a lot of things. So what do you think about filler in the nose? Not a bad idea as long as people are good at it. So that's all. So I'll post this in case anybody wants to see this later. And is it a bad idea to use Juvederm to fill the lips? If you use tiny bits of Juvederm with a 30 gauge needle, it's totally fine. It's totally fine. Otherwise, you guys are here? All right. Well, I'm gonna go.
Yeah.